larval tapeworms. This webinar is brought to you by Leading Sheep and the Department of Agriculture and Fisheries. My name is Nicole Salua and I am your facilitator for today. Our presenter is Dr Louise Mullemeister, who is a Senior Veterinary Officer for the Department of Agriculture and Fisheries based in Roma. Welcome, Louise.
Thanks, Nicole. So as Nicole mentioned, I'm going to speak today about cheesy gland and larval tapeworms. So we'll just start up firstly with a poll, which Nicole will run for us.
Sure. So on your screen, you should be seeing now a question about what enterprises you run. So if you'd just like to click on all that apply to you as to whether you're a commercial sheep producer, a stud sheep producer, and then also whether you're a wool producer or whether you're a fat lamb producer or both. So people are now voting, so I'll just give you a few more seconds if you'd like to vote. 5, 4, 3, 2, 1, and I'll close that poll off now and share the results with you. So 67% of our audience are commercial producers, Louise, and 67% also have stud sheep. 17% have wool and 67% have fat lambs.
Okay, that's quite interesting. So we've got, yeah, rightio. Bit of a mixed operation for some, and quite a large proportion of fat lambs. So that's interesting. All right. Well, let's move on. So I'll just mention briefly the National Sheep Health Monitoring Project, and it commenced in 2007 and is funded by the Sheep Meat Council of Australia and Wool Producers Australia. Monitoring occurs nationally at a number of processing plants. Lines of adult sheep are inspected for a number of important endemic diseases, some of which are listed here. It is done in conjunction with monitoring for ovine Johne's disease. All the conditions monitored can either cause on-farm loss or may affect market access if identified in export meat shipments. Product is discarded or downgraded as a result of the presence of these conditions. Data collected by the project is used to support market access and demonstrates the quality of Australian product. Information provided to individual producers can assist them to improve their flock's productiveness and fine-tune their animal health programs. So we'll run another poll quickly, which Nicole will do for us.
Sure, so I've just launched that one again. So once again, you should see on your screen a question about who has received a feedback report based on the data collected by the National Sheep Health Monitoring Program. So can you just tick yes, no, or unsure if you're not sure whether you've received one. So I'll just give people a couple more seconds to vote. 5, 4, 3, 2, 1, and we'll close that one off. Most people have voted. And I'll share the results. So 78% say no, Louise, and 22% are not sure, and no one has said yes.
Okay, very good. So the data is collected at a number of abattoirs around the country, with Wallangarra being Queensland's main abattoir. So it just depends on where you send your sheep to slaughter as to whether it's an abattoir participating in this project. So a report done by GHD Hassel in 2009, based on 10 disease conditions monitored by the project, found that these conditions cost processors $15 million per year and producers $95 million per year on farm nationally. So the benefits of the program include being able to identify and monitor the health status of Australian sheep to aid with market access and promote quality of our product, surveillance and monitoring of disease trends, targeting regional extension activities such as these webinars, research and development, and providing individual feedback reports to producers, which allows an assessment of the effectiveness of disease management practices on the property and the ability to be able to improve productivity through the use of this feedback. So between July 2013 and June 2014, a survey was sent out to 195 sheep producers, along with their individual National Sheep Health Monitoring Project feedback reports. The survey was conducted to determine the level of producer awareness of certain disease conditions, where they source their disease information, and management strategies used to control diseases. Based on the results from the survey question asking producers to rate their knowledge on a number of conditions in sheep, I've chosen to speak today about bladderworm and sheep measles, due to a large proportion of producers responding that they can improve their knowledge on bladderworm and sheep measles and were unaware that these conditions occurred in their sheep. While most producers reported that they had a fair understanding of cheesy gland, I will cover this condition as well as Hydatid disease due to the similar life cycle it has with sheep measles and bladderworm. So to summarise, today I'll talk about cheesy gland and the larval tapeworms, sheep measles, bladderworm and Hydatid disease. I'll explain what these conditions are, their economic impact, how they are spread, their symptoms and how to control and prevent them. So we'll start off with cheesy gland or caseous lymphadenitis, which is a common contagious bacterial disease of sheep and goats caused by Corynebacterium pseudotuberculosis. All breeds of sheep are susceptible. It causes abscesses in the lymph glands throughout the body, most obvious in superficial areas like the crease between the neck and the shoulder, the flank fold, or in the groin area, but can also occur in internal glands and organs. The pus tends to be a yellow-green colour, which later dries out and becomes cheesy looking, hence the name. So these abscesses must be trimmed out at slaughter, decreasing the carcass weight. The whole carcass may be condemned if multiple abscesses are present. Infected sheep may also suffer from decreased wool production and growth rates. Ruptured skin abscesses or coughing from pulmonary abscesses release large numbers of the bacteria into the environment. The bacteria enters the body through broken or intact skin by inhalation or ingestion, where it then enters the bloodstream. Sheep with infected lungs spread the disease through coughing. It can also be transmitted by breathing infected dust. Close contact between sheep, especially during shearing and yarding, is a common cause of spread. Transmission through contaminated instruments at marking can also occur. So while the bacteria, Corynebacterium pseudotuberculosis, causes cheesy gland or caseous lymphadenitis in sheep and goats, a different biotype of the organism can cause disease in cattle and horses. Human infection is rare, it produces a lymphadenitis and is an occupational disease of shearers and abattoir workers, with infection occurring through cuts. There is no effective treatment against cheesy gland. Prevention and management is the best approach. A vaccine is available, combined with clostridial vaccines as either a 3-in-1 or a 6-in-1, and requires 2 doses 4 to 6 weeks apart with annual boosters. Vaccination will not cure infected sheep, but will reduce the incidence and severity of disease in the flock. Isolate and cull animals with obvious or ruptured abscesses to prevent disease spread. Use clean equipment, yards and sheds, especially at shearing and lamb marking. Disinfect contaminated equipment, yards and sheds properly. Do not plunge dip or shower dip infected sheep. Consider dipping 2 to 6 weeks off shears to allow shearing cuts to heal. Consider shearing youngest animals first, as they are least likely to be infected. Minimise time spent in close contact with other sheep during yarding, and consider marking lambs in the paddock and putting them onto clean grass. So in a Queensland sheep producer survey I conducted recently, I found that 55% of producers that responded used vaccination of some kind as a disease control measure on their property. So are there any questions on that section?
Cool. Thank you, Louise. We just have a comment about your audio. It's a little bit distorted, so maybe if I'm not sure if your mic's a little bit close to your mouth, just pull it away a little bit and we'll see how that goes. We do have a question that someone's already typed in, and so while we're answering this question, if anyone else has any questions either about cheesy gland or the National Sheep Health Monitoring Project, if you'd like to either type them into the question pane or raise your hand and I will unmute you. So our first question, Louise, is actually about goats and whether cheesy gland is common in goats and if there's any monitoring done for cheesy gland in goats.
Yes, so goats can be affected by cheesy gland. It is not uncommon. They are probably slightly less susceptible than sheep, but they certainly do still become infected. And they most commonly, you see lesions most commonly around the head and sternum and neck with goats, most likely due to them being browsers more than grazers, and maybe damage to skin through browsing, and also headbutting during fighting. So it certainly does occur in goats. Monitoring in goats used to occur through the National Sheep Health Monitoring Project, but I haven't received goat information recently, and also it hasn't been reported due to whether, we just don't know whether they're feral goats being harvested or whether they're domestic goats being sent direct from a property.
Cool. Thank you for that. Your voice sounds a bit clearer now too, so that's good.
Fantastic.
No other questions at this stage, so we might move on. But as I said, so after this next section, we will have a question time again. So once again, if you do have any questions, please type them in or raise your hand and I will unmute you. So back over to you. Thanks, Louise.
Fantastic. So we'll move on to tapeworms of sheep. So the life cycle of tapeworms involves both immature and mature stages. The animal harbouring adult stages of the tapeworm are called the definitive host. Immature stages of some tapeworms must partially develop inside an animal of another species, and these animals are called intermediate hosts. So once this development has occurred, the immature tapeworm, also known as a larval tapeworm, is able to infect the definitive host. So the point to note here is that animals can harbour adult stages of tapeworms, or they can harbour the immature larval or cystic stage of tapeworms. So sheep are definitive hosts for the adult tapeworm Menesia expansa, which lives in the small intestine of sheep. They reproduce here, and the eggs contained within the proglottids from the worm are passed in the sheep's dung, and they look like grains of rice. So to become infective to sheep, the egg first needs to be eaten by a mite, the intermediate host that lives in the soil or on pasture. This tapeworm is not known to cause any adverse effects on production or health in sheep, so I only mention it to demonstrate how different stages of tapeworms infect sheep. The ones of particular importance are the 3 larval or cystic stages of tapeworms that occur in sheep, being the intermediate host, using the dog, dingo, wild dog or fox as the definitive host where the adult tapeworm lives. And these are Hydatid tapeworm, sheep measles and bladder worm. The larval tapeworms form cysts in tissues or organs of affected sheep and can also affect other species. So the adult tapeworms live in the intestines of dogs, dingoes and foxes, which are the definitive host, and from now on I'll refer to these collectively as dogs. So the infected dog defecates on paddocks, contaminating the pasture with eggs. Thick eggshells protect them from environmental extremes, and further spread of eggs may be via wind, runoff or flies. Eggs are eaten by sheep, the intermediate host. The larvae burrow through the intestinal wall, enter the bloodstream and lodge in tissues or organs where they form cysts. Dogs become infected by eating meat or offal containing cysts, and the immature tapeworms contained in these cysts then develop into adults. So there are a number of other tapeworms that occur commonly in dogs, foxes and dingoes that don't affect livestock, and we need to be able to differentiate them from these 3 tapeworms that affect sheep. So these are these 3 that can affect, but these are the 3 that can affect sheep and other mammals. So we've got here the sheep measles, and its stage in sheep is called cysticercus ovis. It commonly occurs in sheep and goats, and it affects the heart and skeletal muscle. We've also got the bladder worm, and it affects sheep, goats, cattle and pigs, and it's commonly found in the liver and abdominal cavity. And then we've got Hydatid cyst, also known as Echinococcus granulosus, and it affects a number of intermediate hosts, including sheep, goats, cattle, pigs, wallabies, kangaroos, and importantly also humans. And they are often found in the liver and lungs, but also a few other places. So we'll cover each of these in a bit more detail now. So with sheep measles, the effects on production is negligible and are usually only discovered at slaughter. However, economic loss occurs due to trimming or condemnation of organs or carcasses during processing. If there are more than 5 cysts in the sheep carcass, the whole carcass is condemned. If there are 5 or less cysts, processors will trim the carcass as required, reducing profits. Infected offal is condemned, and there can also be sheep meat export consequences. So with bladderworm, once a sheep ingests the eggs from the pasture, the larvae penetrate the wall of the intestine and migrate to the liver. They can either remain in the liver or migrate further to other surfaces in the abdominal cavity, where they attach and develop into fluid-filled bladder-like cysts, like this one you can see here. Sudden death due to severe liver damage or secondary bacterial infection can occur in sheep with large numbers of developing cysts. Production loss may also occur due to loss of appetite, depression, weakness, and loss of condition. Economic loss also occurs due to condemnation of livers during processing. And lastly, Hydatid disease has similar life cycle to sheep measles and bladderworm, except humans, like sheep, can also be an intermediate host, making it a zoonotic disease. So another important immediate host is the kangaroo, which helps maintain the life cycle. So like sheep, humans and kangaroos become infected by ingesting eggs excreted in dog feces. So Hydatid disease can occur anywhere where the intermediate and the definitive hosts both live. Eggs are resistant to heat and cold damage for a number of months and can blow around in the dust or be carried by water and insects. Once ingested, the larvae burrow through the intestinal wall, enter the bloodstream, and travel to the heart, lungs and liver, where they form cysts. Evidence of Hydatid disease is usually only found at slaughter or after death. Affected organs or occasionally carcasses are condemned. So, as I mentioned, Hydatid disease is a zoonotic disease, so it can occur in people, and this can be done by either patting a dog, then touching your mouth, by kissing a dog, through items contaminated with soil, or by consuming contaminated food or water. Person-to-person and livestock-to-person transmission does not occur. Symptoms in people vary according to the number, size and location of cysts within the body, and Hydatid disease can cause serious illness and death. Treatment involves the surgical removal of cysts, and prevention in people includes regularly worming all dogs with praziquantel, not letting dogs eat offal or carcasses, washing hands after handling dogs, washing hands before handling and eating food and before smoking, not allowing dogs to lick your face, not allowing dogs to defecate in or near vegetable gardens and children's play areas, and cleaning up and disposing of dog droppings appropriately. So further medical advice, you should contact your doctor or health clinic or call the Queensland Health Hotline on 13 43 25 84. And then with all 3 of these conditions, sheep measles, bladderworm and Hydatid disease, there is no treatment available in livestock. So prevention and control is aimed at breaking the life cycle of the parasite by regularly worming all working pet and visiting dogs monthly with praziquantel, which kills the adult tapeworms. Not feeding dogs offal and feed them a commercial dry dog food. Not allowing dogs to scavenge on carcasses. Disposing of livestock and roo carcasses by burial or burning, ensuring water used for livestock purposes such as drinking and pasture irrigation is free of contamination from dog feces. And in a sheep producer survey I conducted recently, I found that 57% of producers that responded prevented dogs and cats from eating offal. So that's not a bad outcome. And that's the section on larval tapeworms, if anyone has any questions.
Thank you, Louise. So that's pretty much the end of Louise's presentation. So we'd just like to spend the next 5 or so minutes. If you've got any questions, now's the time to either raise your hand or type them into the question pane. So while you think about the questions you might like to ask or typing those in, I'd just like to remind you to fill out our short survey to give us some feedback on this webinar. And I've just put the link to the survey into the question pane now, so when we finish talking and answering your questions, if you'd like to click on that and fill out our survey, that would be much appreciated. And if you want to know what other events we have coming up, please visit our website, which is www.leadingsheep.com.au. So we do have a few questions coming in now, Louise. So first one is about whether freezing meat destroys the cysts, or do you actually need to cook it to destroy the cysts?
Yeah, so that's a good question. There's been a bit of research surrounding this. So with bladderworm and hydatids, freezing or cooking meat or offal may not reliably kill all cysts. And with sheep measles, you can deep freeze the meat for 21 days, and that may kill your cysts. But bones are okay to feed your dogs. And it's really only muscle that's an issue with sheep measles. So generally, no offal is a good rule to have, and bones are okay.
Excellent, good to know. So next question is about, so any of the diseases that you've just spoken about, do you happen to know if there's any particular hot spots for those either in Queensland or across Australia? Like, are they more common in certain areas? Do you happen to know that from any of the work or the surveys that you've done?
I only have access to Queensland data, so I can't speak about other states, except I believe WA had a campaign, I believe, on sheep measles to try to reduce the prevalence of sheep measles. I don't know the outcome of that. But basically, life cycle can occur anywhere where your intermediate and your definitive hosts live together. So it can occur anywhere where that happens. So it could be anywhere.
Cool, thank you. And the final question that's in here at the moment. So this is your. If you do have any burning questions that you want to ask Louise about cheesy gland or any of the larval tapeworms, now's your chance to type them in. The final question is actually about, not sure if you can answer it, Louise, but I'll ask it and we'll see how we go. Is there any drench resistance to praziquantel in dogs?
Yeah, don't know that I could answer that confidently. I certainly haven't done any surveillance work on that. Not that I'm aware of, but obviously it could be a potential issue in the future. So I can't answer that, no, sorry. I can look into it.
Yeah, well, we might see if we can find something, and we can send that information to the person who asked that question. So that would be excellent. So
you can only, praziquantel is just for your dogs. You can't treat your sheep for your larval tapeworm. So I'll check the praziquantel resistance in dogs.
Yep, lovely. Thank you. No more questions typed in, and I can't see anyone who has got their hand raised. So we might just finish up there, Louise. If you just wanted to summarise, what are the 2 or 3 key points about cheesy gland and larval tapeworms that you'd like people to take away from today's webinar?
Okay, well, probably my take-home messages would be that cheesy gland and larval tapeworms reduce profitability for producers and processors through decreased production and trimming of carcasses and trimming or carcass condemns at slaughter. Cheesy gland can be managed through good biosecurity, culling infected animals, good hygiene, and the use of vaccination. And the transmission of larval tapeworms to sheep and hydatid cysts to humans can be minimised by breaking the life cycle of the parasites and practising good hygiene and biosecurity.
Cool. Excellent. Well, thank you very much for that, Louise.
Thank you.